Hi, I am Dr. Naresh Bhat, Chief of Gastroenterology and Liver Services at Aster CMI Hospital in Bangalore. We are a unit that specializes in the management of IBD or Inflammatory Bowel Disease, and we are a tertiary referral center for the same. What is IBD? IBD consists of two basic diseases. One is ulcerative colitis and the other one is Crohn's disease, which are both chronic diseases which persist for several years. Most of the symptoms are related to the bowel, like diarrhea, abdominal pain, anemia, and so on. The biggest message that I would like to give is that having IBD does not mean it's the end of the world. IBD can be controlled, and a good control can lead to a normal quality of life. This is something I'd like to re-emphasize because most patients believe that once you have IBD, the end is near. So good control therefore becomes of absolute importance. And what do we mean by good control? One, of course, is using the medications prescribed regularly and following up with your doctor. Our aim therefore is to get the disease under control first and then keep it under control. As long as we keep the disease under control and the inflammation is not there, it cannot progress to complications. Therefore, a good relationship with your treating team of doctors is important. The next is, the team is not just the physician like me, but it involves many others. It involves the nutritionist, it involves the radiologist, it involves a pathologist, and of course our surgical colleagues. So many of us are involved in the multimodality care of patients with IBD, and therefore patients are best managed when you have such a team. I also discussed about close follow-up and monitoring. It's important to monitor the disease closely to make sure that the inflammation is all under control, and we do that by doing simple blood tests, simple stool tests like fecal calprotectin, and the new toy that we've been using, and perhaps the only center in the whole country that's doing it, is bowel ultrasound or intestinal ultrasound. Now this intestinal ultrasound is an extremely useful tool, can prevent a lot of unnecessary MRIs and CT scans and colonoscopies as well, and can be done easily in the outpatient when the patient comes for a follow-up. So doing these simple things can ensure that the disease is under control and we prevent complications and ensure a good quality of life. So remember, IBD may be a chronic disease, but good care is important, and that can ensure a great quality of life, whether it's in a man or a woman. And we can also ensure great outcomes in pregnancy, which sometimes can be a challenge in patients with IBD. So if you have IBD or diagnosed IBD, we'll be happy to take care of you at Aster. Thank you.